Hello, everyone. This is Brian Zimmerman with Becker's Healthcare. Thank you for joining us for today's webinar, Enhancing Nursing Workflows with Ambient AI, Leaning into Conversational Care. Before we begin, I'm going to cover just a few quick housekeeping instructions. We'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you have trouble with your audio or visual, please try refreshing your browser. You can also submit any technical questions into the Q&A box. We've got folks on the back end who are available to help out with that. So with that, I'm pleased to welcome today's speakers, Julia Chow, Chief Operating Officer with Abridge, Rhiannon Frederick, Chief Nursing Officer with Mayo Clinic. Thank you both so much for being here today. I'll turn the floor over to you all now. Thank you.
Hello, everyone. Thank you so much for joining today. I'm really excited for this conversation. As Brian mentioned, I'm Julia Chow. I'm the COO at Abridge. We're the leading enterprise-grade AI platform for clinical conversations, trusted by over 100 of the largest and most complex health systems to improve documentation efficiency so clinicians can focus on what matters most. Before we jump in, I'd like to welcome my co-host, Rhiannon Frederick.
Thank you, Julia. Welcome, everyone. We are so excited that you're joining us today to hear about our collaboration and our work. I'm the Chief Nursing Officer for Mayo Clinic. I've been a nurse for over 24 years and really passionate about improving the environment so nurses can take the best care of their patients, as I know many of you are as well. Maybe we'll just jump in and I'll share and start a little bit about why we entered down this journey. So as a CNO, about 4 years ago or so, I was really probably where many of you are at. Significant challenges in the industry, trying to figure out how to start to support the workforce in different ways than what we'd done traditionally. There were colleagues and health systems across the country were scrambling and trying to find ways to recruit and attract and retain nurses. And I had an aha moment that I needed to start to move forward in a very, very different way than I'd done traditionally in order to make that work environment one that really allowed nurses to be the best that they can be for their patients. And specifically, when I reflected, I had considered myself to be a chief nursing officer and a nurse administrator who is very tech savvy and wanted to bring in tech, both to help patient outcomes, but to help nurses as well. And I was reflecting on all of that work that I'd done in the past. I struggled to think of one piece of technology that I brought in that actually made it easier for the nurses to do their work. Many times we brought in technology and we saw a great improvement in patient outcomes, which is really, really important. But we didn't see and it made it easier for nurses to do their work. And so I started on a trajectory to really think about that differently. How do I change that work environment so that nurses can be their best selves and we make it so easy to do their jobs? They're able to really deliver that high quality, high touch patient care that every nurse goes into our profession to do. We all know the workforce challenges that we're going to be experiencing. And so it's just really important for us to think about this in a new way. And I'm really excited to share that we teamed up with Abridge to create a solution that addresses documentation burden for nurses. No surprise in talking to the nurses when I said, what is the biggest barrier in your day? Documentation was the one thing that I heard over and over and over again. So I was super excited to start a path to try to solve for that. And so maybe we'll hand it back over to Julia. And Julia, I'm wondering if you could share a little bit about Abridge's story and why was this project exciting to you and your team?
Absolutely. So when we started Abridge in 2018, the thesis of the company was that when you think about healthcare, it's really all about people. And what they're doing every single day is that they're having conversations about their health. That is the entry point of all care. And if we could actually use AI not to replace humans, but to really help people understand and structure and summarize the information that came from those rich conversations, then we could actually take care of a lot of the administrative burden, a lot of the documentation burden that clinicians face every single day. We know that something like 43% of newly licensed bedside nurses leave their jobs within 3 years, and that documentation burden is one of the leading causes of why. And so when we really approached this problem, it was from this very holistic view of how might we be able to leverage this new technology to help people ultimately connect better, to help nurses and their patients, doctors and their patients really have undivided attention so that they could actually focus on the things that matter, the touches, the hand on the shoulder, the true care and attention to when you're communicating education or a diagnosis or just in the course of care. And so over the last several years, we've had the privilege to partner with over 100 health systems across the US to really deploy an ambient AI solution primarily focused at physicians to begin with. And that was the beginning of our journey at Abridge. But as we got into all of these different systems, a very natural extension was, and how about nurses? And for us, of course, nurses are truly the backbone of the healthcare system, not only in terms of just the number of nurses that are within every system, but just in terms of what they do every single day to really represent the patient. Nurses are asked to do so much. There's so much invisible work. There's so many demands, everything from actual patient care, patient education, monitoring vitals, continuing to chart all the time. And so that's just a small handful of what I know all of you do every single day. But the idea here was, how might we be able to leverage this new technology to help nurses in their workflow? And we knew from the beginning that it wasn't going to be enough to just try to lift and shift what we had built for physicians over to nurses. It's a fundamentally different workflow. There are different demands that are made of you as nurses. And so what we wanted to do was partner closely with both Mayo Clinic and Epic to develop a solution that was created for nurses by nurses, and that was already integrated into existing workflows so that it wouldn't be extraneous clicks or some other technology that wasn't already being used. So fundamentally, one of our core philosophies at Abridge is this idea of honoring humanity and really thinking about, from the bottoms up, how might we create technology that feels like great air conditioning, where it's something that you're comfortable when it's on, you almost don't even notice it, but that fundamentally creates a better quality of life. And so with that, it's been a privilege to partner with Rhiannon and the amazing team of nurses at the Mayo Clinic to really develop something from the ground up. Rhiannon, do you want to share a little bit about how we approached that development together?
Absolutely. You know, it starts with this foundation that you just heard from Julia about people and putting those people first. And I think in healthcare, no doubt, everybody always puts patients first and patients at the center. And this tool gets there in a different way. We put our patients first by elevating the ability of our nurses to be able to do what they do best. And so that is really, I think, the center of the partnership, where we came together laser focused from the beginning, which is why we've been able to get so far. So super excited about that. You know, in current workflow, without an ambient solution to supplement the work of the nurse, the nursing documentation is very, very different than provider documentation. And so a nurse will go in, they'll introduce themselves to the patient, they'll do that full head to toe assessment and assess all of the different physiological, psychosocial, all of those needs of the patient. And much of that is through question and answer, much of that is through listening or hearing or visualizing aspects of the patient. Much of it is the nurse is processing in their head, and the patient doesn't even know they're being assessed in that way. And then the nurse leaves the room when done, and at some point during the shift, they will go in and document that. And that documentation is unique because in the inpatient setting, there are discrete flow sheets, there are discrete areas in the EMR, sometimes discrete cells where they have to click and add the outcome of that assessment. And so that is one way in current state that documentation for nurses is very, very different from providers who typically have a narrative note type documentation summary. So this beauty of the tool is we didn't want to change the workflow of the nurse. We know that when nursing is personal, the style that you go about doing your work, you doing your assessment, every nurse does it a little bit different and it's personal to them. It's the way that they've kind of developed their style in order to best meet the patient's needs and feel confident that they're doing that. And we didn't want to try to disrupt that and force a new workflow that would be hard for everyone to adopt. And so really what we looked at is how do we create a tool that in the background hears that narrative dialogue between a nurse and a patient and capitalizes on that. You know, every nurse will tell a patient what they're doing, describe that. Now, the degree of that description is a little bit variable by nurse. But what if we had the opportunity to remove those eyes on screens and fingers on keyboard and just focus on that narrative dialogue and improving that narrative dialogue? We call that nursing out loud. And so we're really working on nursing out loud, telling the patients what we're doing, what we're seeing, why we're doing it, what that means. And then the tool just is in the background and it captures all of that. And then we'll translate that in the end to the discrete flow sheet documentation that the nurse is used to doing manually. So two things. First, we always get consent from our patients before we start that ambient session in the background, and that's really important. This is not done to patients, it's done with them. And then the second thing is the nurse always has the ability to review that documentation before it officially publishes to the EMR. And so it supplements the work of the nurse. It does not replace the work of the nurse. And that's really important to us too. And to be honest with you, that's the magic behind the technology that Abridge has so successfully worked to bring to life. And Julie, I'm wondering if you could just tell us a little bit more about that technology and how your team approached it.
Sure. So from a technological perspective, it's actually quite fun and cool to think about how the system actually works. So when you think about a conversation between a nurse and their patient, sometimes there's a lot of ahas, there's a lot of chit chat, there's a lot of, where does it hurt? Yes, ahas. Like it's actually kind of hard to parse a conversation from a machine learning perspective. But what we've been able to do is understand from a conversation, what are the parts that are actually relevant? What are the parts that would actually need to be documented within flow sheets? And flow sheets themselves, I know I'm preaching to the choir here, but there are thousands of flow sheet rows. And the flow sheet rows often differ by system. They're often updated even as frequently as every week. And so it was really important to us to create a flexible system that would work across that could not only extract relevant data, but also map it to the relevant flow sheet rows in a way that follows institution-specific guidelines. And so really that's what we've been building with Mayo and Epic, a deep integration within Rover, whereby nurses can, in the course of their care, tap on the patient's name, record the ambient conversation, nurse out loud, as Rhiannon had said. And then what Abridge will do on the back end is actually pull out the relevant information that was mentioned in the course of that conversation and pre-populate a draft of the flow sheet rows. Now, something that's been really important for us as a company is this idea of transparency. Healthcare moves at the speed of trust. And we know specifically that it's really important for people to understand, where did the AI actually get this information? Can I trust it? And so for every single thing that Abridge drafts for nurses, it is visible within Hyperspace and Rover as a field that is clearly like AI generated. And beyond that, you can tap on it and actually view the linked sources. You can view the conversation transcript to understand, if somebody said that their pain was a 4, was that actually what they said? Or did they actually say it was maybe a 6 or a 7? And it's very easy to go back to the ground truth and verify both with audio and text what had actually happened. Rhiannon, maybe it makes sense to talk a little bit about kind of how the rollout has gone at Mayo Clinic.
Absolutely. We started, before the rollout, we started by bringing in our colleagues from Abridge and from Epic, brought Mayo Clinic nurses into a simulation center and just watched their workflow, and just to get a good understanding as a collective team how it works in real world state. And then we also had the nurses collect those ambient recordings of their dialogue for patients. And so that was all the background that we've spent months working on to really get the secret sauce to build this tool up. And so now where we're at is, in the last 2 months, we have done our initial implementation of a minimal viable product across 7 units. The units are medical surgical units and a progressive care unit. And we have different sites. So for those of you that don't know, Mayo Clinic has sites in Florida, Arizona, Rochester, Minnesota, and then across some community settings in Wisconsin and Minnesota. So we have 7 different units that have gone live with the first viable product that we have. We have about 400 trained nurses that have the availability to use the tool. And what I would tell you is, oh my goodness, that initial implementation has exceeded our expectations in every single way. I mean, I think any CNO or any nurse leader knows, introducing a new technology is rough. Historically, it has been rough because it is a change, and any change is really hard. And right now, nurses have lots of changes that are happening every single day. And so trying to keep up with all of those has been difficult. This is one, I will tell you, that has gone so well. It's exceeded our expectations every way. So first, what I would say is, again, we had our partners. We had Epic, we had Abridge on those units with us as we were going live to really understand what the nurses were seeing and experiencing, to help them problem solve, because there's some education reinforcement that's needed, and just comfort, wanting to bring them comfort. And then if there was anything that wasn't working, we wanted to fix it as fast as we could. So that's how we started. We've seen, so on some of the units, I'll maybe go to our last one. Our Wisconsin sites just finished their implementation about 2, maybe 3 weeks ago now. We went live on a Saturday and a Sunday with those 2 units. They had 100% of the eligible users those days use the tool. And again, totally exceeded our expectation. The other sites were very, very high. We typically saw between 80% and 100% adoption. And so we did not anticipate that. We thought it'd be much, much lower. We've gotten a ton of anecdotal feedback. I would say the first thing that nurses tell us the hardest part about the tool is remembering to hit the record button is frankly the hardest thing in their workflow, that they just need to get that muscle memory in place and remember to remind their patient or ask their patient to start that recording and then actually start the recording. So that's one. But we're hearing so many good things about what they're seeing in the tool. So I would share with you, one nurse was explaining to their patient that they needed to change their pulse oximeter from one hand to the other and why they needed to do that. Walked out of the room, stopped the recording, looked at the documentation, and couldn't believe the level of detail that was in the record reflecting that, and was just blown away. Another piece of feedback that we received in our Wisconsin side, I love this one, was they did a neuro assessment and nursed out loud through their neuro assessment, came back, reviewed the proposed documentation, and the entire NIH stroke scale had been documented for them, and just ecstatic. I mean, that they're telling me, that's 15 minutes that's saving me. And so really, really seeing that benefit from their perspective. I would also tell you patience. And so when you're nursing out loud, when you're walking through the patient, what you're seeing, why you're doing what you're doing, what they can expect, you're empowering and educating them in a way that maybe they haven't experienced before. So we are also hearing from our patients and their families, first of all, a lot of excitement about wanting to opt in to utilize the technology because they want to help nurses. I mean, if you need a heartwarming story about how the public's trust in nursing is alive in action, they are willing to try this technology because they want to do whatever it takes to make it easier for the nurses to do their job. They're also telling us the amount of detail that they're getting and the comfort and the knowledge that that's giving them about the healthcare that they're being provided is just exceptional. And so that is a secondary benefit that we are seeing. that is just, again, those stories are incredible. So Julia, just knowing that your team was on site with us when we started those implementations, anything that you heard from the go lives from your team about their impression of working side by side with nurses?
First and foremost, I think the team just felt incredibly grateful to be a part of this journey and to be a part of the transformation, and to be able to work closely with nurses to incorporate that feedback directly into the product. This is something that is very important to us as a company. Feedback is oxygen, and we truly wanted to create the solution that was for nurses, by nurses. Maybe one important thing to point out here too is that this is not a dictation tool. We didn't want nurses to have to go into a corner and kind of mumble into a phone or say something that was outside of the course of regular patient care. This is really intended to be based on ambient conversations and to have the benefit, the additional benefit, as Rhiannon was mentioning, of actually aiding in patient education and comprehension as well. And so working elbow to elbow with Mayo, the most maybe surprising thing was just, and maybe not surprising in retrospect at all, but just feeling the pull. And what I mean by that is, I think as we've experienced in health IT, there are so many times where there's technology that's just kind of foisted upon people. And it's like, hey, there's a new thing, you got to do it. It's mandatory. Sorry. Like you just got to learn how to use this new technology. And then everybody kind of grumbles a little bit and gets on board eventually, or maybe with a little bit of cajoling from nurse leaders. But with this product, what's been amazing has been truly feeling the excitement from the nurses themselves. And one of the learnings for all of us has just been around how excited people are to be a part of the change and to really embrace this kind of technology and dream of what are the next things that we could do together. Like flow sheet drafting is an amazing first step, a huge step in the right direction in terms of starting to alleviate some of that documentation burden. But there are so many other things that we could do together. And so, Rhiannon, maybe could you share a few of the examples of things that people continue to be excited about?
Yeah, I mean, we get feedback. Probably the number one piece of feedback we get about the tool is what's next. Like they're ready for it continuing to grow and build more and more and more. So that's incredibly excited. So Tube Strains Lines is the one that we're hearing most frequently about as a next build to really, really help them. I would also say, though, that the nurses are also learning the more they narrate, the more that they document. And so that's a really cool phenomenon to see, right? I think, it's not every nurses out loud the exact same way. And so what they're doing is they're experimenting with, well, what happens if I say it this way? What happens if I say it that way? And there's not a script that we've given them to say this and it'll document for you. It's really based on just your conversation with your patients. And so they're learning the more they say, the more they talk, the more they narrate, the more that gets documented. And so we're seeing that every single day. I really think the secret sauce is starting with for nurses by nurses. And you heard Julia mention that for nurses by nurses, but really taking that feedback to heart. And every single time we get feedback, we hear it, we review it, we put on an action tracker, we follow up with the nurses, expanding to patient education, expanding potentially to care planning. I Joe, it's actually not really a joke, but who hasn't had a trouble with care planning documentation being up to par when Joint Commission comes, right? And what nurse would tell you that care planning is their number one priority? No one. So I think helping them with those pieces that are really important aspects of our documentation, but don't rise to the top. And the system is going to be smart enough that it can help with that without putting extra burden on nurse and frankly taking away that burden. So those are some of the things that are really next based on what we've heard from the nurses and as we've brainstormed with both our partners at Epic and Abridge.
Definitely. And on maybe just to build on that too, it was important to us together to make sure that we had a system that could accommodate regular conversation where we weren't asking nurses to say wake words or to say phrases in a particular way. And a specific example we can share is around the way that we document alert and oriented ×3. Rihanna, do you want to share that anecdote?
Yeah, it's actually a beautiful example. So Maggie's one of the lead nurse leaders on our project from the Mayo side, and she saw a nurse in the hallway kind of fiddling with it. So she went up and asked, how can I help? And the nurse was trying to figure out what I need to say to get the system to document as alert and oriented ×3. And the beauty of it is you ask the patient their name, you ask them the date, you ask them where they're at, and then the system will document it that way. And so it's really a kind of a change in mindset for the nurses. That was, I think, one of our very first rollouts, either Arizona or Florida. But it's you just do what you do, and the system will capture it for you in the way you need it to. It is really the way that we're describing it. It's not a dictation system. You don't tell it what you want it to document. You talk to your patient, and it'll capture that behind the scenes. Yeah.
Awesome.
Right.
Well, maybe it makes sense to show a little bit of the technology in action.
Yeah, I think so.
Great. Could we play the video, please?
Hello, Kirk. Okay, I looked at your chart and verified that you have signed consent for ambient nursing, and I'm going to go ahead and start that recording now. It really is a pretty easy process. It's no extra work. It's just what you're normally doing. And I was always taught that when you talk to a patient, everything you're doing, you're explaining to them. And where is that? So that came along perfectly with this because it keeps picking up as I'm explaining to the patient what's going on, is finding where to chart things that we're talking about.
It was good for me because I felt like I knew what they were looking at. I knew what they were finding. I didn't have to question later, well, what was my heartbeat? Well, what was my, blood pressure? He vocalized it, so I already knew that. So it worked out well.
It really takes some of the pressure off as a caregiver to know that my dad has had an experience where he's able to hear directly from his care providers what they're seeing and what they're observing. And it certainly helps me as well to know that he has all the information that his providers have, and also that they're able to spend more time with him. They're not worried about the paperwork as much. They're able to focus on his care, and that just takes a huge burden off of me in worrying about how he's doing and the care he's getting.
So maybe just a couple comments. I don't know if you guys picked up on it. That's Peter. Peter is a nurse in our Arizona campus. So real nurses, real patients in that video. At the beginning, Peter tucked his phone in his pocket. I don't know if you guys saw that or not, but if you remember, we started from a place of wanting less eyes on screen, less fingers on keyboards, and really trying to remove that technology from being in the middle of that dialogue. And so that's one piece that as we collected that video, just magically happened to really tell that story. So super excited about that. And then just you heard a little bit from the patients and families, the difference that this is making for them. So again, very much has exceeded our expectations in every single way, and it's just the beginning. And knowing that, Julia, just wondering if you want to share a little bit as we think about the future of where this could go. How is Abridge thinking about that?
Sure. We, together with Mayo and Epic, continue to think through what are the next sets of use cases, everything from additional types of flow sheets and assessments to net new types of documentation we might be able to help nurses with as well. And so very interested in continuing to help with patient education, with care coordination across teams and more. So very excited for this initial rollout and then step, and looking forward to continuing to build together.
Thank you. And maybe from the Mayo end, I would share, Mayo nurses are incredibly excited about this tool, not only because they see how it is going to make it easier for them to regain some of that connection that over the years that has been pulled from them because of the amount of administrative work that they're really doing to support patient care. And so they're incredibly excited about that. Not only that, though, they know that this tool is being created not just to help them and their patients, but to help nurses across the world. And so they're incredibly excited and empowered about the future, and knowing that kind of responsibility that they have to help their entire profession and all of those patients. And so they're just so incredibly excited and engaged. Finally, maybe I would just add, there's a lot of conversation right now about the responsibly using AI in order to support healthcare delivery. And that is one thing that we have really kept in this project from the very beginning. We've been very, very thoughtful about AI does not replace a nurse. It does not replace the expertise, the skill, the knowledge. It does not replace that, but it does have the ability to help us connect better with our patients by removing some of the pieces that doesn't require their expertise. And so we're excited to continue to find those places and spaces where the technology can supplement and supercharge the role of the professional nurse, and utilize that to make them so satisfied about their ability to continue to do what they all joined the profession for, which was deliver great patient care. All right.
Wonderful. Well, with that, perhaps we should turn to some Q&A.
Excellent. Thank you both so much, Julia and Rhiannon, for a wonderful conversation. And we've got some great questions that have come in from the attendees, so we'll get right to those. But as a reminder for folks, you can continue to submit your questions via the Q&A box on your screen, and we'll get to as many as we can. The first question we'll grab here is for you, Rhiannon. Nurses have seen many technology solutions come and go. What do you think it takes for AI to be truly embraced as a trusted technology for nursing?
Yeah, it's an amazing question, and I will share with you, I'll give you an example. So when I was in a CNO role prior to the one I'm in today, we brought in technology to reduce pressure injuries, and it was very rudimentary technology. It just measured how patients were effectively turning or not turning, and giving a light signal to nurses to help them know if it was time to turn or not. It seemed like obvious great help, right? It's just a visual cue for nurses, no big deal, they're gonna love it. And I have to tell you, that was probably the hardest technological implementation I've ever had. And so when you dig down to the source of it, the reason that one struggled so much is because nurses were turning their patients. They just weren't getting an effective turn, and so they thought the technology was broken. So the aha for me in this one is that was a tool that we brought in and didn't have the background of what does a nurse need in order to set themselves up for success in this to get those better patient outcomes. And I think that's the secret sauce for nurses, by nurses, right? Starting with what does the nurse need? What is the problem we're trying to solve? What is their workflow, and what can supplement that instead of being additive to that? I think that's really the secret to getting this adoption. I think that's why we've seen, I think we've got a little over 300 people who are consistently using the tool out of 400 that have been trained. So, and we're not forcing anybody to use it. So if you imagine that, we've got about a 74% engagement rate from the nurses. I've never seen anything like that in my career, and I believe it is because they have been developing this tool side by side with Abridge and Epic.
Dual benefits there, right? It's going to better fit their needs, but you're going to get that buy-in because they're being engaged and involved in the process, right? Julia, what would you add?
I think that's absolutely correct. And from an adoption perspective, I think there's such curiosity in how this tool can continue to help supercharge existing workflows, and also that continued appetite for the future as well. And so it's been incredible to get all of the many different requests for, hey, I tried this, and I actually would love it if you could help me with this. And so that kind of enthusiasm is something that we just love to see, and that we're so excited to continue to build on over time.
Absolutely. Great questions. And we've got a ton of great questions coming in from attendees, very engaged group. Appreciate it. Let's jump to another one. Julia, this one's for you. The attendee asked, you started with flow sheets, but what other parts of nursing workflows could AI help improve over time?
Sure. We've talked about this a little bit, but to perhaps get more specific, there are so many different ways that this technology could potentially help, everything from care plans and making sure those are documented appropriately, as Rhiannon had mentioned, all the way through patient education. And what are the different types of things that we might be able to equip patients with? If you think about a patient who is getting discharged, and a nurse usually takes a painstaking effort to really educate them on the very specific details of their care. And so often the generic handouts that patients might get afterwards don't actually reflect the specifics of their actual situation, nor do they reflect maybe their health literacy level. And so are many, many examples that we're excited to continue to pursue from a patient education perspective, as well as a care coordination perspective, where when you imagine a nurse and all of the different ways that they're interacting with other members of the care team, other members of the patient's families, what are the different ways in which AI might be able to help them disseminate that information, get up to speed more quickly, and much more.
Excellent. Appreciate the more detailed overview there. We'll jump to another attendee question. I think this one's probably on a lot of folks' minds. The attendee asks, have you seen a reduction in nurse burnout or turnover since implementing in pilot units? Rhiannon, I'll let you grab that one.
Yeah, I can take that one. So the quick and easy answer is we've only been utilizing the tool for a little over 8 weeks. So it's too early to see some of those metrics yet. What we have right now is a lot of anecdotal. But are those metrics that we've got our eyes on and that we're keenly interested in? Absolutely. You know, originally, when I thought through transformation prior to bringing in our colleagues, I wanted Mayo Clinic to be a place where I had nurses lined up to work and more people who were applying than when I had positions available. And so those metrics that you mentioned are all going to be indicators of if we're hitting that mark or not. So definitely watching those for the future, but not necessarily since our initial implementation to see any impact.
Yeah, the anecdotes we've heard, though, have been amazing. Oh, sorry to interrupt, but I just wanted to share a little bit about some of the anecdotes that we've heard where there was a nurse who I think had been a nurse for over 30 years, had actually started his career on paper charts, and kind of seeing the change in the way that care is practiced and the increase in documentation burden over the years, and ended up saying something like, I never thought I'd be a part of something so transformative. Like in my last 30 years of care, this is the thing that is going to help not only me, but the many other colleagues, the many other nurses across the country.
Yeah, Julie, I would also add to that. I was on our Florida campus and talking to them about the tool. And one of the comments I received is, this tool is helping me leave on time. And so not having documentation extend the length of their shift and causing overtime. So again, those are the anecdotals that we're hearing. So we are very optimistic that we're going to see some of those other metrics move as well. But lots and lots of excitement about it from the staff.
Certainly, and it's something to keep an eye on as, you know, Abridge, I'm sure, Julia, you're all thinking about how to measure this over time. And some exciting stuff to come that we, of course, here at Becker's would eagerly await any updates you have, and would welcome certainly another webinar. Let's jump to another question here. The attendee asked, how is the tool used with nonverbal patients?
That's a great question. So the nurse will assess the patient's ability to both give consent and participate in the use of care. And so we have, from a nonverbal aspect, I don't remember getting that question. And so I don't know that we've run up against it. But if a patient, let's just say they're not conscious, they don't have the ability to provide consent. So we wouldn't be using the tool with them in that instance. So you know, we do use, you know, if it's a patient who's perhaps nonverbal, but able to make those decisions, we would work with them the way we do for anything else to get consent. Maybe it's an interpreter, or maybe it's through written, but that's, you know, it's really using your nursing judgment, following your nursing process, just adding this extra supplement to that. Julie, anything you would add to that one?
I think you're spot on. So we've taken a very, very thoughtful approach to the consenting process today. I think as a nurse, there's nothing to prevent you from talking to the device later and to verbalize out loud some of the findings that were done in the room as well.
And there's another attendee question here that I think pairs sort of nicely with this one. So I'll jump to that just since we're on this point. The attendee asks, are there any challenges with varying accents, staff who may not be primary English first speakers? Anything to add there, Rhiannon or Julia?
Yeah,
Sure.
I think, go ahead, Julia, because the tool's magical and I was going to send it to you. So.
Yeah, so this is part of the secret sauce of our technology. At our core, we have one of the key models that we have within our set of AI models at Abridge that we've developed is around being able to have robust accent treatments, to be able to understand people, whether it's regional accents or something else. We have developed the industry-leading audio speech recognition system for medical conversations. And it's not only accents, we're also already being used off-label for a variety of different languages as well. And so on the physician side, for example, we already support over 28 of the most commonly spoken languages for medical conversations. And on the nursing side, where we're definitely evaluating the accuracy of our technologies for different languages in addition to different accents as well.
Excellent. Appreciate the clarity and the questions. Let's jump to some more. We've got plenty, very engaged group, as I mentioned before. So this attendee asked, does the system remind nurses if information is missing from the assessment? Julia, do you want to grab that, and then Rhiannon, maybe some additional comments?
Sure. So the way that we've architected things to begin with is to be very, very true to the conversation that happened. We are only documenting what was verbalized out loud. And as a future step, we certainly could consider continuing to nudge nurses or to request for additional information. But the way it works today is that we draft the flow sheet based on what the system actually was able to hear as a part of that conversation. But of course, if there is something that wasn't verbalized but needs to actually be in the flow sheet, the nurse can go through and just quickly add those last couple of things as well. Rhiannon, anything you might add?
You know, I would just add, so you answered it spot on the way I would have answered it. And I would say it's been a very deliberate decision not to add that at this point, because we want nurses to really love this tool and feel like it's supercharging them. And we don't want them to feel like it's pointing out the negative, right? We want to highlight the positive, which is really those patient-nurse conversations. At some point, could it be a potential add? Yes. Right now, we're just really focused on supplementing what they already do so incredibly well and keeping the focus there.
Yeah, another hint of possibilities here. It's been the results that you've shared, what has been discussed, has been so powerful, but a good reminder that it's still early stages. This is the possibilities here are really tremendous. Moving to a question now, and I believe we got a bit of this in the video that was shared in some of the discussion, but the attendee asked, what is the patient feedback? How has the patient feedback been? Rhiannon, do you want to take that one first?
I'd love to take that one. So the patient feedback has just blown us away. And I would say, starting with, one of the biggest concerns was consent and getting consent, and if patients would give consent. I will tell you, our consents are very high percentages. Again, I would say between 70 and 100% of patients are granting consent, and it typically is on the higher end of that. Patients have told us they want to do anything that they can to help a nurse. We've had patients who have shared with us, patients who've been former nurses, who have shared with us that they were on the floor when we went from paper to electronic charting, and they see this as a way for them to be connected to that next step in the future. And why wouldn't they want to be a part of that? I think patients, that the feeling informed about the care, feeling included, feeling involved, family members being able to step away because they can trust that their family member understands what's happening and they don't have to be that navigator in between the nurse and the patient. Incredibly powerful feedback. And I just think it continues to demonstrate itself time and time again. I mean, even asking people if they wanted to be a part of the video, people were like, sure. And I don't know about you, if I was a patient in the hospital, I don't know if I'd want to be a part of the video. But that's what we saw. I mean, they're just really excited about helping nurses, and they're seeing the benefit of the tool. It's both.
Julia, anything to share from your point of view, what you've heard?
Very similar feedback, and it's consistent with what we've seen across the physician side of the product as well, where there is a willingness and a generosity of spirit from patients where they are like, absolutely, you're going to use this tool that helps you focus on me, and it helps you get something out of the end that helps me with my care too, like core it. So we've seen really positive patient experiences across the board with this type of technology, and we expect to see that continue as well.
Excellent. Okay, let's take another audience question. This one would be great to hear from both of you on. Rhiannon, maybe we'll start with you, then Julia, transition to your thoughts. But the attendee asks, what was the early co-design process like with the nurses before the rollout? From engaging busy nurses in the design process to prioritizing which problem to solve first. Rhiannon, why don't you get us going?
So I will tell you, we started with the prioritization of what problem to solve first. And so when our transformation journey started, sitting down with groups of nurses from different locations, different settings, and working to understand what are the biggest pain points in their day that they want to solve first. And documentation was the number one, without a doubt, that we heard across the board. Documentation is the biggest pain point in their day that takes time away from providing hands-on with patients. And so that was very easy for us to prioritize as an initial step. So that was the very first place that they were engaged. The second place that we worked at is just trying to figure out where do you start within that. And there's a lot of tools out there to change documentation, but we took a step back and said, we want to radically transform what happens. So we don't want to think about documentation. It's not about consolidating the number of flow sheets, decreasing the number of options within cells. Like that would have been a very easy, well, it's not easy, that's hard, but that would have been a step that we could have taken to solve that with the nurses. But the reality is that still that manual, starting from a place of, we want a world where nurses don't document. And I know that might sound like so far out there, but the reality is this tool has gotten us one step closer to that. And I would say a pretty big step close to that. So very excited, and really then moving into the simulation. And so asking nurses, do you want to be a part of a simulation? Here's what we are trying to create based on what we heard from you. We want to make sure this tool is created by you and it works for you. So you want to come to the simulation center and help give us that baseline of what we need to solve for. And so started with that. We had volunteers. So nurses were volunteering to come and help. Every single step along the way has been voluntary. So I guess I would comment on that too, because nurses are craving solutions. This has never been a force. That sim was really eye-opening too, because there are clear times when the tool is going to work and it's going to supplement and it's going to help. You know, if you're running into a situation where maybe the patient is actively vomiting or something like that, you're not going to stop and turn on your recording and ask permission. And so it gave us a lot of insight of, it's not a perfect solution. It can't do everything, but there's a lot it can do. So we learned so much from them there. Then I would say the second part was really championing this vision of where we're creating the future together, and getting those narrative ambient sessions captured, and really tried to, we had to rely on their discretionary effort to get consent from the patients to remember to hit the recording, and then that recording would go to our partners so that they could build the AI behind it. But we utilize that as an opportunity to remind them that they're creating the future of nursing practice and healthcare, and super excited about that. We've had hype videos, we've had education sessions, I mean, everything along the way. And then every piece of feedback we get from them, we put on a tracker, and every week we send out a note about our progress. And we also huddle with the leaders of the unit so that they can give that feedback to people directly too. We want nurses to know, you told us to fix this, here's what we did, or here's the solution that's in process. And so it's all part of that change management, but everything that they share with us, we think through how to make that happen, because they're telling us that's what they need to take this tool to the next level. Julia, would you add anything?
That was a beautiful, beautiful description of the journey that we've been through together. And I think one of the main learnings for us in this phase too has been just around how fast nurses are willing to embrace change as well. Like when I remember one of the initial conversations we had was around at what cadence do we actually want to push out updates to nurses? And we had originally thought maybe just a couple times a year. But what we've learned throughout the process is that nurses want change and they want it now. And so I think it's been really fulfilling to be able to provide a quick feedback loop and push out changes as quickly as every couple of weeks or so to continue to make the product even better. And Rhiannon, I'm curious for your perspective, like, have you seen anything like this in nursing before in terms of the rate of change?
I haven't, and you're being incredibly generous, because I'm the one that said, absolutely not. We're not going to do just-in-time improvement. So Julia's being very kind in that response. So it really was, I think as a nurse leader, I was thinking through this tool the same way we've had other technology and with those challenges that we've had. And what we've seen is just the opposite, right? So if you're going to do an upgrade to other technology, you try to bundle it. You try to only do it once or twice a year because people just can't stay on top of all of it. With this, because the tool hears you and documents, the change just happens seamlessly. They don't have to remember or know anything. They're just nursing out loud. And so what they're saying is that every day they're discovering that it'll document something new and different that they didn't realize from the day before. And so they're craving that. They want more and more and more to be automatically documented. I've never seen anything like this as far as the ask to add and to add quickly.
Thank you both for your wonderful answers there, your detailed answers there. I want to move to another question here that's sort of getting at what else is possible here, or where else this might be going. The attendee asks, are there any future plans to extend the use of this tool to capture clinician-to-clinician conversations, such as end-of-shift handoffs or team huddles? Julia, you want to weigh in here?
Sure. I would say that absolutely. We would love to be able to help in those types of conversations as well, and ultimately help clinicians really, like, we all know that it's in these like critical handoff moments where things can get missed, or where the transition doesn't always go as smoothly as it can. And this is a great opportunity for this technology to potentially help. Rhiannon, anything you might add?
No, I think you captured that beautifully. I mean, I think that there's endless possibility with Ambient, and really just trying to determine where's the best place to start and then grow and build. That's what we've been focused on, and endless possibilities for our future.
Excellent. Next one, I think, is an important one to get to as we move toward the end of our time here together. But considering the fiscal environment that many hospitals and health systems are operating under, this question, I'm sure, is on many folks' minds. How can healthcare organizations justify the investment in this ambient listening technology when budget constraints may be a significant barrier to adoption? I'd love to hear from both of you on this, but Rhiannon, maybe you can get us going.
Absolutely. You know, the question highlights on why those ongoing metrics are going to be so incredibly important. And that's why we are working super hard to determine what those are. So really trying to understand the return on the investment, the return on this with value. And, you know, value can be determined in many different ways. So it isn't done. It's not decided yet. But I do think, you know, looking at turnover, looking at retention, looking at recruitment, looking at quality patient interactions, time saving with patients, looking at if your patient's better informed, do you have smoother discharges? Do you have an ability to return them to home faster? I mean, there's so many metrics that we could potentially have that we're looking at that could show the value of this. And so we're really just starting small with looking at, you know, what what can we demonstrate today, but then as we continue to evolve the implementation and the use of the tool, we expect to really have a robust bucket of metrics that can help demonstrate the value of the tool.
Could not agree more. I think that as we look at the dissemination of this kind of technology, we're definitely looking at a holistic approach of measures, everything from nurse burnout and well-being as a key contributor to turnover rates and all of the many staffing costs that are associated with that. And also looking at things like patient experience as well and how that might contribute to things over time. Unlike the physician product, we know that nurses are a cost center. And so the economics of this kind of tool are a little bit different as well, but definitely something that we're approaching thoughtfully together.
I appreciate the candid insights and answers there, Julia and Rhiannon. Let's move to another question. We got time for maybe one or two more. The next one is, again, sort of getting at or thinking about where Abridge could go next. So, Julia, I'll throw this one to you. The attendee asks, how about Abridge in the outpatient setting and virtual nursing? Is there a possibility to expand technology in the outpatient setting, virtual nursing?
Absolutely. This technology is meant to be used from home to hospital. And we want a world where the access to this is democratized across every care setting. And so perhaps using the physician-facing product as an example, we started in the ambulatory space, but have quickly expanded to support other care settings such as the ED and inpatient. And in nursing, we expect to do the same as well.
Wonderful. Let's move to what will be our final question, which is sort of getting at the attendees getting at sort of how this tool, it's documenting stuff that was previously, invisible, as the word was used. So the attendee asked, what have you learned over time that how this tool can perhaps improve the quality of the documentation? Rhiannon, you want to go first, and then Julia, we'll hear from you.
Absolutely. So I would tell you it's not, it's been amazing, I think, to see what it captures that perhaps a nurse wouldn't have prioritized as adding into the EMR. Our goal was never to increase documentation, but I will tell you it is an unintended benefit that I think we're seeing. It's a very comprehensive set of details about the patient, and it shows, so much of what the nurse does, they do in their head, and they don't always share it, but it's showing such a high degree of, that invisible care, just as what the question asker asked. Seeing that invisible care and then understanding how that fits into that comprehensive package of what the nurse brings. So all of the education that we provide, all of the different components that we're assessing that contribute to those interventions, which help our patients return to health faster. So it's definitely something that we're capturing, and I think really going to give us some insights into nursing workload a little bit differently, going to give us some insights into patient status a little bit differently. Again, not with the intention of increasing documentation, but with just new insights. So it's been eye-opening and something we're still trying to wrap our head around a little bit. Julia, anything you would add to that one?
I think that was spot on. The goal here is really just to help nurses get credit for the care that the amazing care they're already delivering. And to ultimately deliver a more complete set of documentation that really helps paint the overall picture of a patient's health and how that is changing over time. And so really just, I think, an absolute privilege to partner together, to be able to impact nurse experience, patient experience, all while we're able to actually create the types of documentation that are required as well.
Well, that will bring us to the end of our time together. Julia, Rhiannon, thank you so much for coming on the webinar and just really sharing your experience with our attendees. And attendees, thank you so much for being a part of today's webinar. One final thank you to Abridge as well for sponsoring today's webinar and helping us put it together. Thank you, everyone, for joining us today. We hope you have a wonderful rest of your day.
Thanks so much.
Thank you.